Hello, I'm your surgeon.
What is the treatment of my mother?
Your mother has been diagnosed by multiple organ failure, which has causes thrombosis of her right leg, which leads to gangrene. So I'm going to perform amputation surgery to remove her leg.
So is there no other option?
No, for now this is the best option because if it will not be amputated, the infection will spread in the entire body. So it is the best option for now.
And what are the chances of recovery without surgery?
Without surgery, chances of survival is 0%. With surgery, it is 70%.
And why it is so low?
It is low because her body is already weak. Her heart is weak because of multiple failure of organs, and much amount of fluid has already been removed from her body. So her body is weak.
Okay, sir. Doctor, from which part of the leg the surgery has to be done?
Below the knee, entire leg.
Okay, sir.
Before we perform surgery, we are going to confirm some questions regarding your mother. So her name is Julie.
Yes.
Her age is 45.
Yes.
And her date of admission is 2nd of June.
Yes.
So does your mother have allergy to any kind of medicines?
No.
Is she wearing contact lens right now?
No.
So we'll check her urine output, and for now she will be NPO'd out. We'll do a physical examination. We'll check her pulse, heart rate, and she'll be on NPO diet for now till surgery time. And we're going to give her local anesthesia. We're not going to give her general anesthesia because her organs are already weak. General anesthesia will affect her lungs. So we are giving her local anesthesia before the surgery. Okay, so let's see.
The final diagnosis states that the patient has arterial thrombosis which led to the gangrene of the right leg. Patient is on NPO because patient is unconscious and unable to eat, so it should be given parenterally. Antibiotics are good to administer as it kills bacteria in the infected area, such as carbapenem. Anti-inflammatory agents should be considered to relieve pain. Hypobaric oxygenation is essential to treat gangrene as the tissues are deprived from oxygen. Oxygen therapy is also needed due to respiratory dysfunction shown by the patient. This will be done through nasal catheter. Inhalation therapy such as antiseptics and bronchodilators are used. Mucolytics are also considered. Surgery in this case would be amputation. Foley catheter needed to check the urine output. Without knowing the urine output, it's hard to control or monitor infusion therapy. Carbon dioxide and oxygen monitoring need to be done, as carbon dioxide will be higher in this case compared to oxygen as a rule. Central venous access is used to ensure fluid infusion will be faster and in a larger volume. It can also be monitored properly. Correction to anemia and hemostatic system is obligatory and done with the transfusion of red blood cells and platelet for anemia. Clotting factors may also be missing as a result of MODS, which is corrected with cryoprecipitate, FFP, and vitamin K. This is the informed consent form that needs to be signed prior to surgery by the relative in case the patient is unconscious. Only then can the surgery proceed. At 11 a.m., the patient has arrived and surgery is considered at 1:30 p.m. Preoperative preparations will take place between that time frame. In this chart, it shows the amount of fluid being administered hourly. Normal saline is indicated here for fluid loss and hemorrhage in this patient. Dextrose 5% is given for nutritional support as patient is unable to eat on her own. Lactated ringer is given for water and electrolyte loss in patient due to its low blood volume. Red blood cells, FFP, platelet given to support hemostatic system. The total volume of fluid administered would be 3.25 liter. When vital signs and lab test is checked, we would know how severe the blood loss is, which is why the amount is not large because the patient needs to be replenished before surgery. Based on the urine output seen and monitored every hour, we would know how much fluid needs to be administered. The chart above shows how the patient's vital signs are being monitored. The vital signs does not look as good as expected, but this is because surgery is still needed to improve the vital signs. The urine output after 1 hour is also only 20. The desired value is 70, which is why volume of infusion therapy is not a big volume for the patient. The chart above concludes the conversation between the doctor and the relative. Amputation will take place 2 hours after admission and above the right knee level. Local anesthesia will be given because general anesthesia will suppress the already failing respiratory system. The anesthetic used could be bupivacaine, which is used 2 to 3 ml, lasting for 3 to 4 hours. The chances of success rate is low because patient has multiple organ failures and different pathologies such as bleeding. Thus, it is important for the doctor to ask the relative if the surgery is allowed even though there is a low percentage of survival. In this report, the date of surgery is confirmed to 28th of May for the patient who is weighing 70 kg with a height of 170 cm. This is necessary to calculate infusion therapy. The surgical site will take place at the right thigh. All laboratory tests have been done. Everything in the oral cavity should be absent as it could cause asphyxia during surgery if inhaled. Contact lenses should be removed and jewelry should be removed and taken by the relatives. Makeup should be removed to check for the color of mucous membrane, and lipsticks should also be removed to check if cyanosis is taking place. Nail polish to check for refilling time. Clean patient gown, cap and sanitary pad are used for aseptic technique. Essential instructions to the patient's relative are required to ensure that they feel secure about the surgery. Blood is needed as well as pre-anesthetic medication such as atropine or dromedrol. Foley catheter is attached for void. Shaving done 2 hours before surgery. GIT fasting is not needed as patient is already on NPO. Enema is also not needed for that reason. And nasogastric tube is needed due to NPO. The surgical operation report here indicates that the amputation will last for 1 hour. During surgery, these medications are not needed because bupivacaine have been injected and it would be enough for the patient. Local anesthesia is much safer to do compared to these options. Infusion therapy will still be continued during the surgery and the vital signs will continue to be monitored until expected goals are reached.